I'm here with Dr. Vivek Patel with Holy Cross Hospital, and we're going to be talking about innovations in radiation therapy. Thanks so much for being here with us and for visiting the Cayman Islands.
Absolutely. Thanks for having me in your beautiful home.
Now, tell me a little bit well, before we get into some of the innovations with radiation therapy, let's do a little bit of background. I know a lot of times when radiation is being used for treatment, that brings with it a whole other set of issues and side effects, right?
Yeah, absolutely. So even the name is a little bit intimidating, to say the least. When you hear radiation therapy, you think of, Chernobyl, you think of, different wars, et cetera. But really, when radiation therapy is not that intimidating. With modern technology, it's a very, very focal treatment with really very minimal side effects. So oftentimes we use radiation therapy along with surgery or along with chemotherapy or systemic therapy. So when we think of any sort of oncologic or cancer care, we think of basically a tri-modality treatment. So the various modalities or methods are systemic therapy, which can be chemotherapy, hormonal therapy, immunotherapy, et cetera. You think of surgery, and then you think of radiation. And they all complement each other and are used in various facets of the care. Truly speaking, these days, since we have such targeted therapy, the side effects are really minimal just to the area that we're treating. So, if I'm going to treat a lung cancer, I don't expect any side effects apart from those that are in the thorax. So yes, patient can feel fatigued, have a little bit of potential sensation of soreness in the throat or a little bit of reflux sort of sensation, maybe a little bit of cough and shortness of breath that can be ameliorated with medication, but I don't expect headaches or burns or anything below the diaphragm, if you will. So
radiation has really come a long way then.
Absolutely.
Compared to when it was first used.
Absolutely.
Are there certain cancers that radiation is more commonly used for?
Yes, absolutely. So the most common cancer amongst men is prostate cancer. So we routinely use radiation therapy as a non-invasive way to treat prostate cancer. Not only are we able to minimize the side effects, there's less chance of impotence and less chance of incontinence with radiotherapy when you compare it to surgery, but we also have very, very similar rates of control. So in the United States, we follow the NCCN, which is a National Comprehensive Cancer Network, and the guidelines recommend for most prostate cancer that you can have radiation or surgery, so it's kind of an option. In other disease sites, for example, in breast, after a patient, which is the most common in women, of course, what we do is after surgery has been done, we give what we call adjuvant, which means after surgery radiation therapy, to the area where the surgery was to ensure that all the microscopic disease has basically been eradicated.
Okay. And what's new this year? What's new in 2019? What has really changed recently?
Yeah, absolutely. So I feel like all facets of medicine, all different fields in medicine are very quick to take on any innovation in technology, but radiation's even a bit more so. Am I speaking a little bit of bias? Sure, but objectively speaking, we usually work with linear accelerators. So just compared to all the other equipment that is used in other fields of medicine, it's very esoteric, but at the same time, we're using essentially space-age technology to treat our patients. So any sort of change that we can bring that will help give efficacy, meaning our ability to control and target the tumor and minimize dose to normal structures, we try to utilize that. So with that, we have different things such as intraoperative radiotherapy, which means right after surgery is done, we give a little bit of radiation to the post-operative bed where the tumor used to be. So that way, if there's any microscopic cells that the surgeon was not able to see or that cannot be removed, we can give radiation to that area. We also use different sorts of treatment with intensity modulated radiotherapy, so that way we're able to conform, which means give all the dose to the tumor while minimizing dose to the periphery. So that way, if, for example, somebody has a prostate cancer, we're worried about their bladder, we're worried about their rectum, their anus, the bones. Now I can give very, very minimal dose to those areas, which is below the threshold of injury to those structures, so that way there's less side effects overall, but while also effectively treating their prostate cancer.
Okay, so really good news in terms of what the outcomes are for
Absolutely.
these patients, right?
Absolutely.
All right, Dr. Patel, thank you so much for sharing this information with us. Thank you again for visiting the Cayman Islands. And this has been Dr. Vivek Patel with Holy Cross Hospital.
Thank you so much for having me.